Good morning. Welcome to our prostate cancer awareness event. We've been graciously have Dr. Akbar Jalal, Head of Urology at Salmaniya Medical Complex, who's going to give us insight and his knowledge to share with us today.
See, prostate is a man's gland, I would call it. It's a small gland. It's the size of a walnut. It's located at the base of the urinary bladder, and the urinary or the urethra, the tube which carries the urine from the bladder to the outside, runs through the prostate, or the prostate engulfs that the area of the urethra. And the function is, it's a very essential organ for men for the sexual and reproductive as a reproductive function. It secretes, it contains a volume, or I would say the semen, a large quantity of the semen is secretion from the prostate, and it has the ejaculatory ducts and the muscles which will help in expulsion of the ejaculate or the semen outside. The other functions is also it helps, it makes the semen alkaline, which will will be helpful for the sperms in movements and migration in the to reach to the ovum. The diseases that can affect the prostate, because it's an organ, so there can be simple inflammation of the prostate, which is called the prostatitis, and that can be acute or chronic prostatitis if it's not treated on time, so it can be chronic prostatitis. And usually the treatment is with medication, antibiotics. The second problem is it's a disease of, again, elderly. It affects the people after 45 to 50. It's called the benign hyperplasia, or enlargement in general, enlargement of the prostate. It's a benign condition, not a cancer, where it can compress the urethra, and patient may have difficulty in passing urine. The symptoms will be either sort of storage symptoms or voiding symptoms. We'll come to that. The third problem, of course, is the prostate cancer. The treatment of the benign prostatic hyperplasia, or called the BPH, or general enlargement of the prostate cancer, is either with medication or with some minimally invasive surgical intervention. And that, again, it depends on the condition, how severe the symptoms, whether the patient is responding to the medication, whether the patient, despite of medication, having effects on his kidney functions, whether there is recurrent blood in urine, whether the patient is getting recurrent attacks of retention or not able to pass urine. So in these cases, we do minimally invasive surgeries. Basically, we resect the prostate, either something called the TURP, transurethral resection of the prostate, or vaporization of the prostate, either with thermal energy or with laser energy. There are new techniques also, something called the Urolift, whereby you just apply a clip in the prostate tissue, so to make the channel open, or vaporized or new technology called RESM. It's a water vapor, steam water vapor, which will kill the prostate cells. It will burst them sort of, and then the prostate size will shrink, and the urethra or the channel will be open, and the patients can void normally. The symptoms, actually the symptoms are similar, or it's mixed symptoms between prostatitis and prostatic enlargement and prostate cancer. But there may be some specific, more specific to the prostate cancer. In general, the symptoms of what we call them the lower urinary tract symptoms is frequent urination. The patient needs to go very frequently to the toilet. Nocturia, where you need, or it's night frequency, you need to wake up at night and go to the toilet. It's weak stream. Urgency, that if you feel to go to toilet, you have to go immediately, otherwise you will leak. Sometimes it's difficulty in passing urine. The patient needs to go very he goes to the toilet, comes back, and he feels again not emptying fully. The other symptoms which are more specific, like being blood in the urine, blood in the ejaculate, in the semen, and the lower back pain with the symptoms of lower urinary tract symptoms. If somebody has frequency, urgency, blood in urine, blood in ejaculate, and lower back pain and the pelvic pain, then that is highly suspicious that the patient needs to go and do the checkups. Again, I would ask people to come forward to discuss these symptoms, not to get worried, because not if all these symptoms can be because of the cancer, but they can be because of other simple infection or urinary tract infection. So if you have any of these symptoms, you go to your physician. They will do the necessary examination and will confirm whether there is any chance of cancer or not. So that's why. And these are simple investigation. You don't need to worry about it. And I would recommend every person who is above 50, or if they have a family history of prostate cancer, even 5 or 10 years earlier, come forward and do a regular checkup annually to make sure you are detected early. And once you're detected early, then the cure is, as I said, almost 100%. Of course, as men, especially in this region, we are very much concerned to discuss any related to our sexuality, our reproductive system. So that's why people a bit hesitant to come forward and discuss about such things. See, prostate cancer is a worldwide problem. It's the second most leading cause of death among the cancers in men. And the statistics show that, in our region, it's a bit less, but even though it's like the third cause of death after the lung and colon cancer in men. And it's increasing. The trend or the incidence of prostate cancer is increasing in our region. So for that, we have to make our men aware of the conditions, and to make sure that they are investigated or detected earlier. As the good thing about the prostate cancer, that if it's detected early, the treatment or the cure is almost 100%. So that's why we urge the people to come forward and get checked. First of all, I would like to tell you about the risk factor. Every disease has a cause, but if we talk about prostate cancer, there is no specific cause of prostate cancer. There are some risk factors which increases the chances of having prostate cancer in men. Number one is the age. As older we grow, the chances of prostate cancer will be more. The incidence of prostate cancer at the age of 60 is around 50 to 60%, but if somebody is around 80, so it jumps up to 80%, the incidence of having prostate cancer. The second risk factor is the family history. If someone has a family history of prostate cancer, then the chances of having prostate cancer in the first degree relative, it increased to 8 to 9 folds. It will be, if we compare a normal person to someone has a relative of first degree having prostate cancer, so the chances of having the prostate cancer with the other person is more. So that's why again we come to the screening and coming forward to get investigated. The third cause is the lifestyle, the food that we use, the animal fat, especially the junk food and the animal saturated fat that we are using, that is proved to be increase the incidence of prostate cancer. The smoking has not direct relation, but in case of prostate cancer, it can aggravate or reduce the prognosis of the cancer in terms of the treatment. The last but not the least is the ethnicity. It's been seen that the prostate cancer is more common in African origin. Even those, if you look at the population in United States or even in Middle East, So the incidence of prostate cancer in the African origin is higher than those of Caucasian or fair skins. The type of the prostate cancer, it is, mostly it's an adenocarcinoma of the prostate, but there are some other like small cell carcinoma of the prostate can happen, but mostly it's adenocarcinoma. The thing is, we don't know yet which prostate cancer is slow growing, which is normal or the most of the cases, and which case is aggressive, which is fast growing. But it's thought to those patients with genetic origin, especially some genes are there, BRCA1 and BRCA2. In those cases, it is more aggressive in such cases. Coming to the tests, there are two ways of looking at the prostate cancer. One is the screenings. Some countries, they do have screening campaign. So any person who is above 50 years old, they ask them to come forward without any symptom, without any problem, to do a screening test, which comprises of a blood test, which is called the prostate-specific antigen, the PSA, and the doctor will do a physical examination, which is called the digital rectal examination, to feel the prostate and the consistency of the prostate. Nowadays, the guidelines also advocate adding the MRI to the screening, but it's more of diagnostic than a screening because it will be more expensive as a screening tool. So by screening, you examine or you investigate the normal population by doing just the PSA and digital rectal examination, and if there is any suspicious, then you convert them to the diagnostics. And diagnosing is, again, by physical examination, by doing the digital rectal examination, and doing a blood test. It's a simple blood test, which is, again, PSA, prostate-specific antigen. If there is any suspicious, either in digital rectal examination or in the PSA, then you have, or the doctors will ask for an MRI of the prostate. By that, the suspicion will be higher. To confirm the prostate cancer, the doctors will definitely ask to do a biopsy, which is done through transrectal ultrasound, either transperineal or transrectal biopsy, and that will confirm whether there is a disease of prostate cancer or not, and also it will show you the degree of the disease. And on top of that, once we diagnose the prostate cancer, then we have to look at the stages of the prostate cancer. By staging, I mean whether the prostate cancer is localized, or it is locally invading the surrounding tissues, or there is distant metastasis to the lymph nodes, to the bone, to the lungs, liver. So that is done by doing either a CT scan and bone scan, or nowadays the newer technologies are there by doing a PET scan, especially something is called PSMA PET scan. That will give you the spread of the disease, whether it's localized or it's outside the prostate. Screening has no side effects as such, because you are diagnosing or you are detecting diseased people and to try to treat them early. And once you detect the disease in earlier stages, the cure is almost 100%. There are some countries which stop the screening policies. That is only because detecting or doing the biopsies, once you reach to a stage of doing biopsy or even doing the PSA, sometimes the PSA may be a borderline, slightly high, but it's not confirmatory to prostate cancer. Then the patient sometimes may think, or there will be sort of a dilemma whether, or the fear from the patient that there may be a cancer and the doctor is not giving me the full details. So that's the main concern. When it comes to the diagnosis, apart from the screening, how you do the diagnosis is by physical examination, by doing the digital rectal examination, and by doing the prostate-specific antigen, which is a simple blood test. And if there is any suspicious in either of these, then your doctor will ask for an MRI to confirm further. And if the suspicious is high, then the main, I would say, the diagnostic tool is to take a biopsy from the prostate. So taking a biopsy will give you a confirmation with the degree that it's a low grade or intermediate or high grade, and you can do the risk stratification of these cases. So the biopsy itself may have some simple, I would say, sometime intermediate side effects in that. But the screening as such, there is no side effect, and it's just some normal population, and you detect the disease in an earlier stage, and you can cure those patients in at the earlier stages. Yeah, if you look at the statistics, the mean age of prostate cancer is around 65 to 70 years of age, but it can affect younger age group, but the incidences are very low. I mean, we've seen in Bahrain patients at the age of 40, 45 to have prostate cancer, but normally it's very rare in younger age group. It's an old man disease, as you mentioned. Yeah, that's very important and interesting question. There may not be any statistically significant studies on the diet, but almost every diet has been tried or tested to see the incidence and the prognosis of the disease. The main thing in the diet is the animal fat or the saturated fat. That is proven to be a high risk of prostate cancer. And people may think of whether some diet will reduce my prostate cancer or reduce the growth of prostate cancer. The studies, as I said, is not statistically significant, but there are if you definitely if you take low fat, especially animal fat diet, that will reduce the risk of prostate cancer. If you eat vegetables and especially like if you're eating fish which contains omega-3, that is studied and proven to be protective from the prostate cancer. But that's, again, I would say it's not statistically significant, but it has an effect on reducing the incidence of prostate cancer. The natural remedies, one of the natural medication is called the saw palmetto. It is the main ingredients, and the pumpkin seed that is thought also to be protective or to reduce the risk of prostate cancer. But again, if we look at the statistics, that's not that much significant. But it will help, of course, if you eat healthy. If you are healthy, then the chances of any disease, including the cancers, will be less. PSA, or the prostate-specific antigen, it's a simple blood test. Actually, the prostate secretes I would say an enzyme or an antigen that is very much necessary for the sperms, and that will make the semen alkaline for the reproductive. It's important. But as a test, it's a simple blood test, does not need to be fasting or any special preparation. And the PSA, there is a range between 0 to 4, and which is beyond 4 is suspicious. The PSA, as its name is prostate specific, but it's not a cancer specific. So there is a difference between prostate specific. It is, yes, it's coming from the prostate, but there are other causes which can elevate the PSA levels. Like if you have a urinary tract infection or any infection within the prostate or the genitalia, like testis, so that may elevate your prostate. There are some physical conditions, like if a person has done cycling or horse riding or prostatic massage, that will elevate the prostate, the PSA or prostate-specific antigen immediately. And it has a half-life of like 72 hours. So that's why it does not mean if the PSA is high, that is definitely a cancer. So that's why we do a digital rectal examination, we do an MRI, and the confirmatory test, which is the biopsy at the end, that when you do the biopsy, you will see the cells under the microscope, and that will confirm whether there is cancer or not. See, as a cancer, the name cancer is disturbing, not only the patient, but the whole family and friends. Of course, the Bahrain Cancer Society and the other societies are there as a supportive team, or I would say, or bodies that will, if you have any question or any queries about prostate cancer, you always can go back to the group therapies, I would say, or at least knowing about the disease. Why I'm saying that? Because prostate cancer usually is a very slow growing cancer. It's unlike the other cancer, which are, I would say, rapid grow. If you don't treat them on time, they may progress and it will cause into the death. Even if we talk about the treatment is not like what we know, that if you use a treatment for a cancer, then your hair will fall and your body mass you'll become thin and all this vomiting. It has nothing as such of these side effects. So it's a slow growing cancer. But again, as a name cancer, you need some support. So there are support therapy from the Bahrain Cancer Society, and even we are here if any concerns, any question, any issues, so you can refer back to us and we will be more than happy to answer you for that. That's a possibility, because as I said, as older we grow, the chances will be there more. So maybe it will be detected at age of 50 or 60 or 70. So that's why the test is required to be done, or I would say the screening needed to be done annually, once a year, that you make sure that you are safe and no cancer is there. But there is something I would like to mention here. There is a large number of people having benign prostatic hyperplasia, which is the normal enlargement of the prostate. That is not a cancer, and that will not convert or change into a cancer. So those patients has benign prostate hyperplasia will not change to cancer, so not need to be worried and bothered about the cancer. But yes, we as doctors, and we also advise the patients to do annual checkup to make sure that the prostate is normal and healthy. Definitely it will not go away, because the changes in the cell, once it happens, it will be there and it may progress. It will not go back and it will not regress. About 20% of the prostate cancers are silent. So they are detected as advanced. So, and that's another reason which will tell, I would insist that people, or the men above 50 should go and do the screening or do the checkup. About 20% you don't have any symptoms. So if you ignore it, definitely those patients will have more advanced disease, will have metastatic. So having about 20% detected advanced is not a small number. So I would not recommend anybody to just ignore it and don't do a follow-up checkups. The treatment, I would take you to through the phase, that what we do with a patient coming initially, either a patient come with symptoms or he is come through screening. So there is digital rectal examination where the doctor will feel some suspicious nodules or irregularities in the prostate tissue, or the PSA will be high. And then we do the MRI to just check the prostate if there is any radiological changes in the prostate tissue. To confirm it, we do a transrectal ultrasound guided biopsy for the prostate. That is a very small needle which is injected in the prostate to take a sample of the prostate. We take multiple samples, and it's a simple day case procedure also. So with that, under microscope, we confirm the presence of cancer or not. Once the cancer is confirmed with histology, then we look at the staging and the grading. The staging means whether it's localized or it's gone beyond the prostate. That is done by radiology, by X-rays, either a CT scan or a PET scan or in a specific PSMA scan, as I mentioned earlier. The degree of the tumor, whether it's a low grade or intermediate grade or high grade, it's calculated or done in labs with something called Gleason score. This is a scoring which will tell us that the tumor is, it's a low growth or it's a high grade, low grade or high grade or intermediate. So based on these parameters, whether the prostate is localized, whether the Gleason score is low, usually if it is from 6 to 10, below 6 is not cancer, 6 is cancer, and 6 to 7 is low grade, 8 is intermediate, 9, 10 are high grades. So again, localized tumor, the Gleason score, and then we will decide the treatment. So if it is low grade, the treatment can range by just surveillance, active surveillance we call it. You do annual check whether this disease is growing or not. If it's not growing, it is recommended or it's within the guideline, we just follow up these patients without doing any treatment. And if it is an intermediate or high risk, then you have to interfere with treatment. The treatment, again, it comes whether it's localized, and also the other patient's factors are also important. Patient's general condition, patient's comorbidities, his life expectancy. Then the best treatment for localized is surgical to remove the prostate and remove the cancer. If it is locally invaded or there is a metastasis, then the surgery will not have no roles in the treatment. So then comes the hormonal treatment and radiation. It can be alone or it can be combined. And there are different stages also. After hormone treatment, there is a small number which will come hormone resistant. So in those cases, you have to change modify the treatment into some different modalities, chemotherapies, or androgen blockade treatments are there. So the treatment depends on the grade, the stage, and I would say the risk stratification. We do risk stratification, and based on that risk, we counsel the patient, we discuss with the patient the treatment options, and accordingly, the treatment is given. Bahrain, first of all, I would like to add one more thing, that the incidence of cancer, the disease is more common in Western countries, America and Europe and New Zealand and some African countries. The Middle East, Bahrain has less number of prostate cancer comparing to the other. Even the death rate is less. And the treatment, the diagnosis and treatment facilities are well established in Bahrain. We may not do a screening, which a lot of countries, even in Europe, they stopped doing screening. But those patients in the risk factors, the health center are doing the investigation, or the clinics, they are doing the initial PSA. And if there is any suspicious, they are referring to the urologist. So the diagnostic tools are available, all advanced tools are available. When it comes to the treatment, all treatments are available locally, either in our hospital, in Salmaniya Medical Hospital, or if there is an advanced cancer needs to be followed up in the cancer, Bahrain National Cancer Center, we do refer some cases to the cancer center for further management. Those patients who require surgeries, that is also the government has availed or made the treatment available either doing it locally or the government is doing their part in sending to specific centers if needed in specific cases. In summary, I would say the prostate cancer is very common, though in Bahrain we are least. If we rank them according to WHO, we are country number 160, and we were in 2018 158. So the service is also improving, and the death rates has significantly improved. Yeah, so it's the second most or third most leading cause of cancer-related death. And the risk factors, as we said, aging, the lifestyle, the food, the family history, and the ethnicity. We cannot change. I mean, if we talk about prevention, we cannot change our age, we cannot change our family history or the ethnicity, but we have our control on our food, the type of food that we eat, our lifestyle, to have a healthy lifestyle. So I would recommend everybody to eat healthy, do exercise, quit smoking, and do regular check. Once you reach 50, please go and check. The facilities are available. It's simple, nothing to be concerned or worried about. And even if it's detected, the cure is there. So the treatment is there. So please come forward and get yourself checked.
Dr. Jalal, thank you very much for your inspirational insights, the positive attitude, and we would welcome for everybody to learn the lessons that you've given us is prevention, detection, and awareness of the issues about prostate cancer. I'd just like to share with you a personal insight because Dr. Akbar Jalal doesn't know. My uncle passed away from prostate cancer about 10 years ago. So it affects us all in some way. And myself was concerned about my prostate, and I went for a test only 8 weeks ago, and alhamdulillah, everything was negative. So all the answers that Dr. Jalal has given us and the insights are very, very important for us all to take on. The normal macho theory that we have in our society and the culture, that has to be put into the back burner and realize that prostate cancer does kill and does affect us all directly and indirectly. Thank you.